Hello, how are you, Tucker?
I'm good, Lilia. How are you?
Good, nice having you today on our podcast episode. Lots to discuss, lots to learn from. And obviously, I would like to give you a warm welcome, a quick intro, how you have been working in the last couple months, let's say, years on XYGene. I would love to know more about the story, how it all started, and what's the overall mission. Can you help us?
Yeah, sure. So my name is Tucker Marcheso. I am the president and one of the co-founders of XYGene. The four founding partners, we are taking a really unique approach to the environment, which is each one of us come from a different pain point around medical testing and patient care. So myself, I take from a payer role. Patrick, he was a laboratory owner. Eric is a laboratory scientist and laboratory director, and Jeremy's a provider in urgent care. And what we realized upon talking to each other about the difficult things about our day is that there was a lot of common ground. And those common grounds were things that were solved by technology that just didn't exist. And so we took it upon ourselves to really understand the depths and complexities about where those missing points were. And that's what we developed our technology around, was really, how do I assist the provider to be able to have less work to do, to be able to get better outcomes and more times with their patients, while at the same time bringing the really cool science that's out there delivered to the point of care where everybody wants it.
Amazing. Thank you. So, one of the things that you touched upon is obviously helping solve some of those key pain points that exist right now within the healthcare space. One of the things that we briefly chatted offline before setting up this recording was talking about the interoperability, which challenges and how are you solving them, like a couple examples or key things that will be relevant for us to discuss.
Yeah, interoperability, at least in the United States and other places as well, is an incredible uphill battle for everybody to solve. You have, laboratories that have really incredible testing and science, and they have an uphill battle because if they want to get into where your doctor needs to use that technology and science, they have a cost out with no guarantee of utilization. And they're all competing the same ways, which is archaic. Like, we're 2025, almost 2026, and 70+% of all, testing communications is still faxed. It's a tough thing to wrap my head around. And so what we're trying to do is we're trying to alleviate the burden of interoperability, because if I'm a laboratory and I have the best science in the world and those providers want it, that doesn't necessarily mean they can have it, because now the lab is responsible to pay up a bunch of money to say, well, look, I want to have this in your environment, but providers are busy. Ask any of them, and they're going between different systems already. So even if they have something that's really robust inside of their electronic health record system, they still either can't find it because they have to dig and they don't have time, or they supplement utilizing other technologies. So all we're saying is we want to make it easier on both ends. So we're taking away the interoperability lift about hard integrations into large, it's almost like an EHR cartel, right? They're really big, they're really powerful, and they have a lot of money. And if you're not willing to play by their rules, you don't get to play. But that doesn't help, because when you're dealing with a large health system and they want to integrate a local provider, and that local provider might not be on the same EHR, and maybe they don't even have the affordability to be able to take what a health system can afford to be able to adopt and integrate. At the end of the day, the problem is that the patient is who suffers, because now they're doing extra work. The communication gap is already broken. The laboratory is just trying to do the best thing that they can to provide the test where it's wanted, but they can't get a common ground. So that's where we land. We will die on the hill that I don't want to use a portal. I don't want to use a fax. These things need to be inside of a native workflow that's going to allow for a provider not to have to think about it. No provider is thinking about what lab they're using. They want the test, they want the outcome. All we're saying is, it doesn't matter how many labs you want to use. I'm going to put them all in the same place. Really easy for you to use them. So the problem of interoperability is maybe one of the biggest barriers of new science coming into the healthcare industry.
Thank you. Thanks for the insights and for summarizing how it works and the solution it provides to the overall healthcare. So if I'm understanding correctly, or in a nutshell, the solution you're providing is a platform that streamlines lab, pharmacy, all of them are like workflows in place. And then there's, let's say, a network that has been created, and that way it has all the information in place, and then providers, clinics, and other players within the healthcare space can interact.
Yeah. So yes, to begin with. So the first thing we had to do is we had to find a common ground, something that they don't have to learn something outside of their own familiarity in order to do their job. But we also had to kind of create a common nomenclature around the process, something that they're all agreeing to, or that is happening in the background so that their agreements, even though the communication types are different, the outcome is the same. And so we built that sandbox for them all to play in. In addition to that, what we're also trying to do is we're trying to measure outcomes, because what happens is it's not enough just to be able to order a test, for example. The provider now needs to know, well, did that test get run? Was there a problem? So they're doing a follow-up and a check and all these other types of things. What we're saying is, I want a chronologically correct point of care example of what's happening in real time. And we're the first people that just figured out how to do that. It's a really boring problem that we're solving, but it's everywhere. So essentially what we're doing is we're just saying, look, I'm going to make it easier for a doctor to order a test. I'm going to make that test, if it's complex, before it comes back to the doctor, is we have to make sure that they're able to digest the information. So when you and I, Lilia, when we go to get a test and we get something that's complex, that requires maybe a genomicist, your provider probably doesn't have that skill set. Now they have to extract information based upon the results. 70% of everything that happens in medical relies on a result. So if there's complexity, we can also route it to people that are in place to give proper knowledge-based information to now make it a digestible thing for a doctor to be able to utilize. So even though I'm not a professional, I can understand the criteria necessary to treat my patient based upon things that would normally be in a 56-page report. I'm just giving them the digestible information where they need it, when they need it. So it's a huge issue that's really, really boring to the point that they don't think about it. It's just, they consider it normal way of doing business. But this solves those types of interoperability issues. I'm getting rid of the expensive big barrier, because we do not need to do a hard integration. I don't have to talk to them. But we're really able to work with the provider on an individual basis to say, what do you need in order to do this? Because we're using their workflow. We're just cleaning it up a little bit.
Perfect. Thanks. The other question that comes into my mind would be how, I am assuming, but just to confirm, you're leveraging AI, right, to provide this solution and maybe to manage all the data that comes across?
Yeah, I'm glad you're bringing up AI, because it's super relevant right now. So yeah, there are AI components, but it's also really important to always keep the doctor in the driver's seat, right? So we're never telling the doctor what to do. We're just giving them a easier way to do the job they already want to do, and they're driving the ship. So AI can do a lot. AI can clean up some of the process. It can identify things. So we use things, machine learning and AI, to be able to help qualify and authorize. So if I'm a doctor and I have 10,000 patients, and I want my system to be able to identify based upon criteria how many qualify for this type of test, and I would have missed that in my normal screenings when I'm meeting with these clients, that can be within literally seconds. We can have that information. The problem is that being able to make that information actionable. So the types of tests that they may qualify for, they may not have the relationships to be able to broker today. So we satisfy both sides of that. But AI right now, one of the things that's worth mentioning is providers are vendor fatigued. So they have all these labs that we're discussing coming to their door asking to buy lunch. We have drug companies and all these people that are constantly, every day. And so they're turning away most of that. So the vendor fatigue issue is big. And now in the world of AI is knocking at everybody's door and saying, well, we can solve your problems with AI, not really understanding where the problems lie. So AI is absolutely a tool that is going to be essential for the future of healthcare. The implementation of it has to still be around the human, and it has to have really, like any AI, it has to have good, reliable knowledge base that it's pulling from. So being able to coordinate the things like sources of truths and information that you're pulling from while following different guidelines are all things that are essential in building into these components, because you can't steer a doctor. There's Stark laws that you have to worry about with labs. There's rules by the state. All of those things have to coalesce, but AI should be an assistant tool inside of the workflow as opposed to a replacement of the workflow.
Perfect. I love that point. One of the key things and insights I'm trying to unveil through this series, obviously, besides giving great information and valuable for the audience on around health and overall wellness, is this piece like AI, it's around, it's here, but how are we utilizing it? And obviously, it has to be on the best interest and for our benefit for patients, but as well as healthcare providers. There's lots of tools in place, and it's just, as you mentioned, that was a really great way to put it out there. They are the bus drive, like they're at the seat, they're driving the bus, and then based on the relevant data, things that come as part of tools that they're leveraging, they can make decisions, they can probably streamline their processes and have a better, less burnout, one, and
Yeah.
then better care for their patients.
Yeah. Spot on. So, we try to look at it from all points of view. Like Jeremy, he is in an urgent care every day. It's stressful, it's high volume, and it's getting more because as the United States healthcare system is shifting constantly, how are they keeping up with it? Well, they're keeping up with it by passing the buck of workflow, which ultimately trickles down to us getting less and less care. AI is going to be an essential tool to be able to try to alleviate burden, because at the end of the day, what we all want, including the provider, is more time together to discuss that. Anybody that you ask is going to be likely frustrated that, hey, I got 15 minutes with my doctor, and 10 of those minutes they were charting. 5 of these minutes, and so you're going to see advents of things changing. Like functional medicine doctors have really blossomed into the space because what they're willing to do is look more holistically and take the time to do that. But those are also things that you're cash pay and out of pocket. So you're starting to get more and more of a pay to play style of environment, which is difficult. In my local network, for example, when you're dealing with Medicare and stuff, there's providers who are just frustrated with billing insurance. And a lot of that has to do with like reimbursement on laboratories or testing and things like that. So what they do is they have a concierge service. You're going to say, well, you're going to pay a model of $250 a month just to have access to me, on top of everything else. If you want direct access with me and I'm going to spend the time with you, here's my cost. And so that's disparate, right? In order to create equity within the system, we have to look at, to what you said, burnout. Burnout's a real factor. Turnovers are high. How do you retain talent? Because we don't just want a doctor. I want a good one. I want a doctor who has a full set of tools and access to help me when I'm seeing them. That is a very, very difficult commodity to find today. AI is going to be helping with that. It's going to relieve workflow, but it's more of a relationship. How do I consolidate relationships to be able to make sure that the need of the client is met? That's what we're trying to do, is lay those tracks so that we can transport good information, because everything else, AI is going to be assistive, but it still needs a track to run on. AI still needs to be delivered. It still needs to have cohesive things. So where we are not going to be an AI focused company, I'm going to be a transport system for that good AI to be able to do the job at the point of care.
Amazing. Thank you, Tucker. And one of the other things that can be related to the last couple of points you were mentioning regarding insurance providers and the tools we have in place, as well as how to make things accessible. One of the key things that caught my attention last time we were chatting was pharmacogenomics. So obviously, if you can expand on that, on how having this information in place will help obviously provide or assist the patient on how to make it accessible, how to leverage it. Probably it's a term that not everyone will know in the audience because not all of us are healthcare providers. But I think that will be really interesting, an eye opener, and things to learn more on how that is integrated within your platform.
Absolutely. So PGX, which is short for pharmacogenomics, for the listeners who don't understand what that is, essentially, and I'm a Marine, so I'm going to make this as simple as I can. It's a one-time test that essentially determines how you, the individual, metabolize drugs. Now, we are a polypharma country. Most people are on a medication. The older that you get, the likelihood only increases until you get to something like a geriatric population, which is on average between 8 and 14 drugs daily. Right? That's a lot. So anytime that you have multiple drugs inside of a body, it's like a chemical soup. And so there's interactions that happen, good, bad, or indifferent. So why I bring up PGX, and I think that you key in on it, is because in the world of genomics reaching the mainstream of the public, I think it's going to be one of the fastest tests that actually have a relevant outcome. So a lot of us are familiar with like 23andMe or, Ancestry DNA, which was kind of like the first thing. And what they're looking at is they're looking at your whole string of genomics, good, bad, or indifferent. That's what the first big exposure to the United States was. PGX is not doing that. They're not really collecting your data for sale. What they're doing is they're saying, well, if Tucker is taking 4 medications, the ones that he's taking, is he metabolizing them well? Because if he's not, maybe there's a better fit. If he is metabolizing it well, maybe we can use less of it or time it better. If there's going to be this drug, and I was fine when I took this, but by adding this one no longer works, that's important to know. The most important thing to know is this dangerous for me to take? So death by improper drug prescription is one of the highest things that we die from in this country. So it is a big problem. PGX is something that not only can you get that information back, and this comes back to your earlier question, to have for the rest of your life, to be able to have advocacy over your own prescription health. It's something that when you're older and don't have that advocacy, it's on file and it's helpful to you. I will use my own self personally. I don't mind sharing this with you. So I've had a PGX test done. I mentioned I'm a Marine. I go to the VA healthcare. The VA has authorized PGX testing. So I was able to take my results, bring them back to my provider and say, well, your drug recommendations that you made for me, I was an intermediate metabolizer of all of them. Here's a list of the ones that I metabolize well. Can you pick from that list? And he was tickled. Absolutely. This is great. I can do better prescription. I'm still in the driver's seat and you get better outcomes. Everybody wins. So there's further adoption. So the Kentucky Teachers Health kind of kicked off a big impetus about this, showing where the cost savings were for doing these types of tests. California has now opened up biomarkers. Colorado's opened up biomarkers. And now Medicare just recently opened up PGX testing. The problem is, so extremely valuable test. The problem that we face today is there's nothing inside of a provider's workflow that is prompting, does this person qualify? Now, a provider can identify that, but know that patient, but we just got done talking about burnout and time spent and where they're able to look. And do I have a medication therapy history in there? Most of the time, the answer is no. So what we're saying is I want to be able to provide that style of an environment for them to be able to reach into at a given notice. I want to qualify and authorize those orders. So, hey, doc, these are the people that would qualify. This is why. Would you like to order a test? Yes. And then we give them the way to do that. At the end of that, because your doctor's not a genomicist, we're going to say, well, what source of truth is important to you for you to make the decision to help your patient? So we just give it a little detour. So after it gets to the lab, it goes to the source of truth, and then it goes to the doctor in a deliverable, digestible format. That is essential. The reality, the sad, scary reality is that your doctor gets large amounts of information, but they have to dig through that information to get the results. And they just don't have the time. And so a lot of times you get a skim and a guess. So that is difficult to wrap your head around, but it's the sad reality we live in today. That's what we're trying to address. So PGX is at the forefront of what I think that your listening public is probably going to have exposure to here and some familiarity with. And I would encourage you, if this is your first time hearing about PGX, to inquire with your PCP. If you're working with a pharmacist, there's an entire industry right now of pharmacists who are leaving big pharmacy and going independent, utilizing PGX as a way to help their clients de-prescribe. So that is a big shift in our industry. If anybody is aware of, the mass exodus coming from pharmacy, like Walgreens and all the big ones, they're closing for a reason, right? Pharmacists want to practice at the highest level of their license. And right now, they don't have the ability. This is one of the types of tests that they can use in order to kind of bridge that gap where a provider doesn't have the time or the access to the resource. So that's, I think, something that is happening. It's happening today. But PGX has been around for like 25, 30 years. It's just been refined and improved and now it's to the point where it's actually getting notoriety and traction.
Yes, lots to learn, and I believe with this type of format and the changes that we've seen maybe in the last couple of years, let's say with the overall individuals, we are trying to be well versed, educated in health. So I find getting this type of information that is digestible, that is easy to access through experts like yourself makes a difference on being proactive. I think one of the big changes and shifts I've seen or heard from other guests is that portion. We are looking at what's maybe broken out there on the healthcare system. And part of the fix is how do we take a proactive approach? How do we make those changes and make it happen rather than just be on tons of medications once you have a problem? And as you said, probably I'm using this medication for, I don't know, liver issue, but it's causing me another thing because I have no idea of how my body works, my genetics, and whatnot. So that's really an eye opener and will be a game changer as well.
Agreed. And I think that just to give you a little hope is that science is really progressive. It's just about how do we get these really smart individuals who might not have a business forward view to be able to get what they need where it needs to go. And the things that are going to be really important is not so much the test itself as the intelligence based upon the test. So things like looking at what is a drug-drug interaction, what is a drug-gene interaction, what are two drugs together interaction, what's a food allergy, what's allergy, what are all these things, and all they can all be put into one place if done appropriately. But really the only way to understand that is to have a panoramic view of what the industry does from all sides. That's where we kind of separated ourselves, is where everybody's siloed. So what we are doing is we're just saying, well, look, I don't know what this provider ordering experience, and I don't know what this laboratory ordering experience, and I don't know how that intermixes with the pharmacist and then the patient. We had to figure that out. But at the end result, good science applied in a way that's digestible and has a measurable outcome, that's what counts. That's what moves the needle.
Yeah, and I think you're bringing those silos come and communicate without really having to make that effort per se, right? Because everyone is busy in their very own area of expertise. As you mentioned, there's no bandwidth and capacity to be looking into the various components, and the communication is not ideal given where we're at from a technology standpoint, but not really on an operational point of view. So that's really a great solution that will make changes, and how you came together with your business partners also creates that specific kind of view on integrating things, having the different backgrounds you have. So you are touching and looking into all the variants across those couple, let's say, communities or providers, to put it in a simple term.
Absolutely. Yeah, it's essential. Like nobody you can't do healthcare alone. That's the reality. You can't do healthcare alone. And there's a lot of people that think that they know everything and they don't. You can't be autonomous. You can't be one thing in the industry to make something work. They have to work together. And if they can't work together, if they don't have a common ground to do that on. And so it sounds really simple. It sounds really basic, but it is something, it's our biggest challenge. Like, we do not have a good way of doing that today. Facts is not doing the job.
Totally. Thanks. So probably a couple other things. Are there any strategic considerations that you have envisioned, like from the opportunities? Not sure if it's probably just local at this point in time, but then international partnerships, things that you feel will make a change and will drive adoption and make this happen in a faster manner?
Yeah, that's a really clever question, because so not only are we looking at the grounds of provider, laboratory, and pharmacist, but we've actually also we're working with the manufacturers of the people that make the machines that run the science. We're also working with the application companies on the phone to be able to deliver this to the patient. We are trying to really be an end-to-end solution, because what we've learned over the last 8 years is that there's no way that you are going to know anything in this moment that's not going to change in the next. And so if you're not connected to all these points of what changes, you're going to have a gap. And that gap means adoption or not adoption. So we work with one of the world's largest manufacturers of some of the best scientific equipment on the planet. And they are utilizing us as a way to say, well, look, when I'm going in to sell into a laboratory, they are selling the best science. But what they're not selling on is, hey, laboratory, you need a way that you can get the volume to support this very expensive machine to run good science. So that's where we come in and we say, well, listen, laboratory, the relationships that you have with these doctors or whatever, that makes it, let me help facilitate that to make it easier for you to adopt better science. And so there's countries that we're working into, like we're talking with South Africa right now, parts of the UAE, parts of UK. What they're interested in, they have a different system than we do, which is helpful because it consolidates a little bit more of it, but it also structures different. I'll give you an example. Like in Canada, they're kind of like on one system per province. You know, one of the other provinces may have the same thing. But when we're working with a Canadian province and a network there, I'm really just dealing with one thing that has to trickle down. So for us, it can be a little bit easier, but the payment structures are different because people that are paying through it like we do, where I'm private paying into insurance and versus something that might be more of a, you know, a socialized style of medicine, then that's something that it just changes the metric. But the delivery need is still there. They still need better connections. South Africa right now, their biggest thing is they want to push. We have a big initiative on PGX, which you just mentioned down there. And so what they're trying to do is they are saying, well, look, I have pharmacies. So Canada's the same way. So in South Africa, up in Canada, pharmacists can actually order about, you know, a series of different types of tests. They don't need a provider to do that. So in Canada, during COVID, they just didn't have enough people to go around. So they said, okay, well, look, pharmacists, you can run these 13 different tests and sign off yourself because that's going to help the populace. So they still have that. So what I can do now is I can say, well, look, that PGX test that you mentioned earlier, you don't have to go to your doctor and make an appointment, spend $35 copay, wait in a bunch of sick room with a bunch of sick people, make a second appointment for a result, and go to your local pharmacy, pick it up off the shelf. Done. So we can facilitate easier use where those kind of things are available. That doesn't exist in the United States. However, there's similar versions that do. So we can start to spread out more and more based upon the relationships with manufacturers, based upon rule sets. There's other places in the world that are more friendly to new technology than the United States. It takes us a minute to adopt things, so there's places that can use like CRISPR. We're not allowed to really utilize that. We can start communicating with companies that are able to do that kind of work. And even if it's not in the United States, we can still plug that in. And so the goal is that we work collaboratively with usually the labs in order to be able to provide better testing through a network that's ever growing based upon consumer need, industry change, policy change, and the like. So international is already something that we are working into. It just takes a lot of time and effort to kind of balance, technology between countries. That's the other big barrier is what are the technological restraints based upon country that we're going into. Everybody wants data. Everybody wants your data. Everybody wants your medical data. The PGX actually, I think, is one of the first early advocacies of you kind of having ownership of some of your medical data.
Great. Well, those are great news. I'm in Canada, so for me, it's great to hear like there's the opportunity, or there might be coming down the road. And as you mentioned, I know there might be other barriers, or you have to learn how things work in every country, and there's different pain points and things that will be easier to get into the market, and others that will make it more complicated. But sounds exciting for sure. And yeah, thanks for sharing all this great information. Not sure if you have any final thoughts, comments, a way to close all the things that you've been working on with your partners. I know there's more to come, so we're sharing below your social handles and ways to reach out so anyone can get more information, but please feel free.
Based upon, if you have a listener that's made it this far, good on you. I would say that you're genuinely interested in finding a fix. I think that it's a frustrating industry. We're all banging our heads against, a wall, trying to figure out, why can't I just have what just seems really, really basic to have? I just want to be healthy. I want my family to be healthy and safe. And I would just tell you this, ownership and advocacy is really important. It's your health. Nobody is going to care more about your health than you. And I think that doctors and nurses and medical practitioners are unsung heroes. They're grounded dust. They didn't get into business to do charts and administration. They got in business to help people. They want that. I want them to have that. I want to help the helpers help. I'm going to encourage anybody that's listening to start asking good questions around what more can be done. Because if you're not asking, neither are they. And whether good, bad, or indifferent, it's not like it's not their fault. It's just that it's the world that they live in. And because of that, it's what we're subject to. Having things that you can educate yourself on about, say, genomics, it's not only something that you can get empirical evidence so that when you're dealing with somebody that might be intimidating, like a doctor who said, well, I'm prescribing this because I've done it for 30 years. I'm right, you're wrong. How do I argue that? I don't. But my empirical results can do something like that. And there's tons of genomic things, cancer, rheumatoid arthritis. There's all kind of wonderful, wonderful tools out there that you just have to start asking about. So if your provider doesn't have the answer, I'm not going to say go to, a witch doctor, but I am going to say, look at what your options are, because even if they're not covered, some of these tests are inexpensive, and you can start establishing advocacy for yourself for your life. That right there is important. We're not turning our health over to somebody's opinion. We are now advocating on our own behalf to have better outcomes. That fixes things. So I would just say, educate yourself. It's interesting. It's like Star Trek. You can find really cool stuff that's happening right there. I want all this really cool stuff. That's the only thing that keeps me going, is I get to see what's out there and I know what's coming. I just want it to get there quickly. And so do your providers. So have a heart with them. Next time you see them, thank them. It's their job stuff. Laboratory scientists, if you happen to meet one, maybe not shake their hand. They do really gross stuff, but thank them. It's a thankless job. Your pharmacists, it's a thankless job. They are running on tight margins. It's tough to provide care for you. I would just say that if you get the chance to build the awareness and then give yourself advocacy, you're going to do you and your family a world of favors.
Thank you, Tucker. Those are inspiring words, and I second you on that. Like, we need to be thankful with frontline workers, healthcare providers. They do lots, but also something we can do to change our lives and be part of the solution is being proactive, learning. And if there's a tool, there's something we hear, discover, there's no harm in asking or raising the question and sharing information. Sometimes when you're at a conversation, a casual conversation even, someone can share with you great content, and then if you pass it over, it can really change lives.
Exactly right.
Awesome. Well, thanks again for being part of the episode of this series, and we'll keep in touch to hear more and share with the audience.
Thank
Thank you,
you.
Tucker.